Hello everyone, myself Pavithra. I am working as a nursing tutor in E.S College of Nursing. Okay, today we have discussed about the bronchial asthma. Okay, in this bronchial asthma is the one of the respiratory disease. Now we are going to the introduction of asthma. Asthma is the chronic inflammatory disease of respiratory tract. It is characterized by bronchospasm and inflammation of mucosal lining of bronchial tree. This is the inflammation of the bronchial lining of the bronchial tree. Okay, in this the normal airway and this is the obstructed airway of the bronchi and bronchioles. Due to this main functions of this lungs, it's a inhale O2 and exhale the carbon dioxide. In this function is disturbed in this obstructed airway. Okay, next it is characterized by recurrent attack of breathlessness and wheezing. It is most common chronic disease in children and adult. Next one is the types of asthma. First one is the extrinsic asthma and second one is the intrinsic asthma. Then other types is childhood asthma. Okay, first one extrinsic asthma. It is also called as the allergic asthma. It is more common than the intrinsic asthma. It is usually begins in the childhood. It is caused by agents such as dust mites and lint, pollen, then mold spore, then wet dander, then smoke, then medication and foods. These are all the main causes for the extrinsic asthma. Mainly in this asthma caused by allergies. Then in this person with extrinsic asthma in allergic to this. Okay, then intrinsic asthma, it is also called non-allergic asthma. It is usually start later in life over the age group of 35. Then it is more common in the female. It is typically more severe than extrinsic asthma. It is triggered by many internal disorder like upper respiratory infection and common cold and nasal polyps or exercise. Then others, childhood asthma. Mainly in this childhood asthma say inhaled pollen and catching of the cold and other respiratory tract infection, and it is not a different disease from asthma in adult. Then it's a trouble to sleeping due to the shortness of breathing and bouts of the coughing or wheezing and trouble in breathing. It's occur at the age of 0 to 6 years. Others like adult onset asthma, then exercise induced asthma, then cough variant asthma, then nocturnal asthma, steroid resistant asthma. Adult onset asthma means it's considered when asthma symptoms are present for the first time of during adulthood. That is called a adult onset asthma. It occurs in people older than the age of 20. Main symptoms producing by the coughing, wheezing and feeling shortness of breath and pain in chest. It's a common symptoms of the asthma in adult. Then exercise induced asthma is it is a narrowing of airway due to the lungs triggered by the strenuous exercise. It does not cause the asthma but can trigger symptoms in patient who already have the asthma. Then cough variant asthma, it is features a dry and non-productive cough. An ongoing cough is the only symptoms of this types of asthma. Then occupational asthma, it is caused by inhaling fumes, gases, dust or other potential harmful substances. Main in this occupational asthma, who are working in the industrial area, they can occur in the occupational asthma. Then it includes the general symptoms of asthma such as the coughing, wheezing and chest tightness and shortness of breath. That is the occupational asthma. The next one is the nocturnal asthma. It is also called as the sleep related asthma, occurs during the time of inflammation of airways. That is the nocturnal asthma. Only in this asthma occur in during the sleeping time. Okay, next steroid resistant asthma. It's a failure to respond to high doses of oral glucocorticoids. That's all the steroid resistant asthma. While when we have to administer the steroid drug, that time the failure to high doses the oral glucocorticoids. Next one is the causes of asthma. How the asthma is occur. First one is the exact causes is unknown. Then first allergic reaction, then physical exercise, then medicine, stress or viral upper respiratory tract infection. Mainly in the domestic animal pet danger, then stress and certain medication, dust, chemical and perfumes, then air pollution, smoking, genetics and respiratory infection. These are all the causes of asthma. Who are all the risk factors? Tobacco, then tobacco chewing, then air pollution and exposure to chemicals and upper respiratory tract infection, stress and gastroesophageal reflux disease. These are all the risk factors. Then warning signs of the asthma. First one, headache and stuffy or runny nose, sore throat and coughing or wheezing after the exercise, then difficult sleeping, then feeling moody or irritable, then tiredness or weakness during the physical activity. These are all the warning signs of the asthma. Then what all the symptoms may occur during the asthma? First one, the chest tightness and coughing, especially at night or when laughing. This is the symptoms. Then coughing occur when the laughing time and night time. Then difficulty in breathing, then shortness of breath, sleep problem and result from the breathing issues, then wheezing sound and chest when the exhaling. These are all the symptoms. Then wheezing and chest tightness, hypoxia and diaphoresis. Then non-asthma often occur at night in the early morning. That's the shortness of breath and protective cough. Then tachypnea, increased respiration rate and increased heart rate, tachycardia. Then nasal flaring as acute respiratory distress syndrome. Then lips pursued in an effort to exhale. Use the accessory muscle of respiration, then diaphoresis and hypoxia. Then what are the diagnostic evaluation? Mainly we have to collect the history and physical examination, then atrial blood gas test, then lung function test and X-ray, CT scan and the 6 minutes the walking. These are all the diagnostic evaluation. Then chest X-ray. Then medical management, especially the inhale the corticosteroid, then beta agonist, then controller medication, then leukotriene blocker. This are all the medical management of the asthma. Then bronchodilator is example aminophylline. It's used to dilate the bronchioles and maintain the pattern airway. That's why we have to using the bronchodilator due to the maintain the normal airway pattern. This includes the beta adrenergic, example albuterol and methyl xanthines. Then aminophylline and theophylline, it's an anticholinergic, example the Atrovent. Then master cell stabilizer drug, it's a nadochromyl sodium, then inhaled steroid, then leukotriene modifiers, that's a montelukast. These are all the medical management for the bronchial asthma. The next one is the nursing management. It's educate the patient and family members about the causes and signs and symptoms of asthma and how to treat the asthma. Then second one is the monitor the vital signs, then respiratory assessment, then ask the patient or significant others about current medication, especially those used to treat the other illness. Then inquire about the exposure to allergens and to avoid the pollution. Then a patient with the new diagnosis of asthma may be asked to assess the home and work environment for likely trigger to the symptoms to avoid the industrial area and the pollution area. That's we have to advise the patient and family members. Then inquire about the precipitating factors of cough. Then monitor therapeutic level of theophylline. Then instruct the patient to avoid the pets for the futures. Then encourage to instruct in deep breathing and directed coughing exercise. Then observe for changes in level of conscious. Then monitor side effect of administered medications. Then instruct the patient to avoid visiting crowded places. Then teach patient about uses of inhaler and instruct to keep inhaler with self of case of emergency. Then encourage the patient and family members to ask about their doubt. That's all about the nursing management. Next one is the complication, the status asthmatics and the respiratory acidosis and respiratory failure. This many complication may occur. The poor functions of the exhale process of the carbon dioxide and respiratory failure. This all the complication may occur for improper treatment means. Then patient education and health maintenance. Teach patient and family members about asthma, then purpose and actions of the medication trigger to avoid. Then instruct the patient and family members about peak flow monitoring. Then advise patient to use a dust proof covers for mattress or pillow. Then encourage patient and family members to get a flu shot every year and get pneumonia shot or as advised by healthcare provider. Then instruct the patient and family members to contact healthcare provider if they notice the following. That's all. Thank you.